Hi, my name's Dr. Emily Marchant,
And I'm Dr. Michaela James.
and we're researchers based in the medical school at Swansea University working on the Happen Wales primary school network. We're going to give an overview of what Happen is, what we do, and how you can get involved. So, what is Happen? Happen is a network which brings together schools, health, and research in line with the new curriculum for Wales and specifically the health and wellbeing area of learning and experience. Happen was established in 2015 following research that we conducted with head teachers and healthy school coordinators to try to find out what some of the barriers were for schools prioritising health and wellbeing. Head teachers told us that they valued health and wellbeing, but felt that literacy and numeracy targets were a school's core business, which took time away from promoting health and wellbeing. Head teachers also felt overburdened and called for a better understanding of school needs, giving schools autonomy and involvement. Head teachers also wanted to collaborate, bringing in people from research and health to work together with schools to be able to prioritise health and wellbeing. The articles on the right are two published papers which give a little bit more information as to why Happen was developed.
Happen aims to bridge the gap between research and practice. So we know that there's a relationship between child health and wellbeing, educational attainment, longer term health and employment outcomes. And we also know that school staff feel overburdened, that there's a lack of collaboration and that they advocated for more autonomy and involvement to promote health and wellbeing in schools. So we aim to bridge the gap between the research and school practice. And that's where the network comes in.
So, how does Happen work? Pupils in years 4 to 6 complete our online health and wellbeing survey. We're also going to be piloting this with year 3s, so if you want your school to get involved with that, please do let us know. The Happen survey takes about 20 minutes to complete and collects a range of information about typical health behaviours. This includes physical activity, nutrition, sleep, wellbeing, safety, and the local area. We feed back that data to your school as an individualised school report, sharing school level information about your pupils' health and wellbeing with national averages. That allows you to identify and prioritise different aspects within your school report. Your Happen School report can be used to inform your school curriculum design, tailored around the health and wellbeing area of learning and experience. For example, identifying topics that you might wish to bring into the curriculum, but it can also be integrated within other areas of learning and experience too.
Alongside your report, you'll receive a Happen Action Plan template. This template has been developed alongside primary schools and allows you to make tailored changes alongside sections of the report. So that means that you can make individual changes to things like physical activity, diet and dental health, sleep and concentration, and well-being and mental health. On the right-hand side, you can see an example of a primary school which has used this action plan template alongside their pupils to develop a more tailored and individualized action plan to make changes that will benefit pupil health and well-being.
This is an example of what your school report will look like, broken down by different health themes. The network provides the opportunity for pupils to learn and make informed decisions about different areas of their health and well-being. You can also use the report to work with pupil voice groups to allow children to be ambitious and creative to improve their health and well-being. To date, over 400 schools have registered to take part in Happen, and over 19,000 pupils have taken part in our Happen survey. Alongside Happen supporting schools to design and deliver their new curriculum, Happen can also be used to evaluate school-based interventions and school practice. This is an example of some of the evaluations that we've conducted through the network, including outdoor learning and the Daily Mile. Evaluations such as this can identify some of the barriers and facilitators to running programs such as outdoor learning and the Daily Mile. This enables schools to implement evidence-informed interventions for maximum impact for pupils' health, well-being, and education.
Through Happen, we have been conducting rapid research in response to the COVID-19 pandemic and how this has impacted the health and well-being of primary school children in Wales. One study that we've recently had published looked at how lockdown impacted the health and well-being of primary school children in relation to years previous. This involved over 1,000 children across Wales, and overall findings from this study showed that as a group, many things improved during this period of school closures for children, including things like physical activity, sleep, and general well-being. However, there were significant differences and inequalities when we looked at this by free school meal eligibility, and improvements were mostly observed in those children that were not eligible for free school meals. This study showed the short-term effect of school closures on children's health and well-being and highlighted a number of concerns regarding wider physical inequalities. This research suggests that there is a need to address these inequalities, and it really highlights the importance of the school day, including things like free school meal provision.
Another study that's recently been published surveyed over 200 primary school staff across Wales. We wanted to explore what staff perceptions were of the impact of school closures and what some of their experiences were during the initial phased reopening in 2020. Based on the perspectives of primary school staff, we identified 5 key recommendations for the future. The first is the importance of prioritising the health and well-being of pupils and staff. This is because the staff in our study noted the wide range of negative impacts of school closures on pupils' health and well-being, including decreased physical activity. Staff also felt that their well-being had been ignored during school closures and called for things like staff breaks to be protected in the future. The second recommendation is around enabling parental engagement and support, and this is primarily because of the importance of parental support during home learning. School staff wanted to build on some of the positive experiences, such as improved relationships with parents, and emphasize the importance of strengthening links between the home and school going forward. The third recommendation identified the impacts of digital exclusion on pupils' home learning, but also about the competence of pupils, teachers, and parents, and staff suggested digital training sessions. The fourth recommendation to adapt the learning environment and teaching practice was based on staff experiences during the phased reopening in June 2020. School staff spoke of the benefits of having smaller class sizes and more staff in being able to provide tailored support to those pupils that really required it, in addition to fostering whole school well-being. The final recommendation, clear communication of guidance and expectations, was based on staff advocating to be involved with the decision-making, such as changes to school practice and guidelines. School staff wanted advance notice of changes to guidance and said that this would also help to manage parental expectations upon the return to school.
Alongside our published research, we also have a number of studies that we're currently working on. Happen data has been included in a factors influencing wellbeing during COVID study, and we found that to support their wellbeing, children have reported that they would like to be able to play with their friends more.
We've also looked at how different school-based mitigation measures during COVID-19 are associated with infections in pupils and staff within the school setting and school staff well-being. Finally, we've been using data from the Happen survey collected over the last 6 years to look at whether children's health behaviours are associated with either being tested for COVID or testing positive for COVID-19.
All of our research findings have been presented to the Welsh Government's TAG and UK Government SAGE groups to inform their education response to national school closures and reopening.
The network is also collaborating on an international research study with over 35 countries through the Global COVID-19 Health Literacy Network. This study aims to examine the impact of the pandemic on head teachers and senior school leaders, including their working demands, stress, and how they're prioritising health and well-being.
So what are the next steps for your school to be involved in Happen? You can register your school to take part in the network using the link below. And once registered, we will send you all the information you need to take part. Once you've registered, we will send you the steps for running the Happen survey. The survey is available in English and in Welsh, and it can be done whenever suits your school at any point in the academic year. Once complete, we aim to get your report back to you within a month so that you can implement change with your pupils. If you have any further questions, you can head to the FAQs page on our website. Once you've headed to our website, make sure you click the Register to Take Part link to get started.
Happen is funded through the Economic and Social Research Council, the ESRC, and we're really proud that it was recently shortlisted as a finalist in the annual Celebrating Impact Prize. The prize is an annual opportunity to recognise and celebrate the success of ESRC-funded researchers in achieving and enabling outstanding economic or societal impact from excellent research. Happen, the health and attainment of pupils in a primary education network, is based in the Faculty of Medicine, Health and Life Science at Swansea University and began as a local public health project in Swansea. Happen is a primary school network that brings together researchers from health and education with schools. It's part of the National Centre for Population Health and Wellbeing Research, funded by Health and Care Research Wales. Through my ESRC-funded PhD, I have been working to expand Happen as a collaborative network of health, education and research professionals across Wales. By working with schools to implement a Happen survey and action plan, my research enabled and empowered more schools to make evidence-based changes to their school community and to improve the health and well-being of their pupils. During my PhD, I further developed Happen to offer a meaningful framework for schools in Wales who have been tasked with the design and development of their own curriculum by the Welsh Government. One of the 6 areas of learning and experience in Wales's new curriculum is health and well-being. My research aimed to capture specifically child health information such as nutrition, physical activity, sleep and well-being. I linked this to administrative educational attainment data and health records, which I accessed through the ESRC-funded SAIL databank, working with the Administrative Data Research Centre. The Happen survey is completed by pupils and shared with schools as a school report. The results can then be used to give schools a better understanding of pupils' physical, psychological, social and emotional health, helping schools to make meaningful changes and to develop their new curriculum aligned to their pupils' health and well-being needs. I also developed Happen as a platform to evaluate school-based programmes, including outdoor learning and the Daily Mile.
Emily's support and work with us on the Happen survey has been invaluable. She turned the findings from the survey into a meaningful and tailored action plan to benefit children, and we use the survey each year to feed into our school development plan and to plan our curriculum using data from our pupils' health and well-being. As a school, we also took part in Emily's evaluation of outdoor learning, which helped support the implementation of our outdoor schools policy effectively. This resulted in the school gaining an excellent judgment from Estyn, the school inspectorate, for well-being and attitudes to learning.
It's fresher and I've got more space to learn, really, and it's less stressful because I can have some space to myself if I need it.
Over 20,000 children have now shared perspectives on health and well-being through the Happen survey. And over 400 primary schools in Wales now receive a school report tailored to their pupils' health and well-being needs. The next stage in my work with Happen is to address the challenges during COVID through the award of an ESRC postdoctoral fellowship. I am also working with over 40 countries on an international study to examine the impacts of the pandemic on head teachers and school leaders across Wales and the UK.
If you've got any questions, you can head to our website or email us. Make sure you're following us on social media and tag us in all of your survey updates.